We will start with the land acknowledgement as we do with all of our webinars. This land acknowledgement is based on the location of ISMP Canada main office in Toronto. You can feel free to place your land acknowledgement in the chat box. If you wonder where you might find that, there is a website called nativeland.ca. We acknowledge we are hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and the Inuit people. We are grateful to live, work, and play on this land, and we want to contribute to the implementation of the Truth and Reconciliation Commission's 8 health-related calls to action. Okay, so this is our timeline for today. We're going to start with a brief welcome and introduction, and then we are very privileged to welcome Jessica Kayitesi as our guest speaker today. And I'll tell you a little bit more about what she will speak about in a few minutes. And then we're going to go to our breakout rooms for 30 minutes and really get the dialogue started about the topic that you chose when you registered for the webinar today. Then we'll come back together and do a quick poll and roundup of the learning that happened in those breakout rooms. So we do want to learn more from you, and together we will improve medication safety. So it's important to continue to hear your voice. In a moment, Suma is going to launch the poll that has 3 questions. When it pops up, you'll have to scroll down and see and answer all the questions. So Suma, if you could go ahead and launch that poll, thank you so much. So what is your primary role in healthcare? You have a few choices there. If you are a different expert and you join us, that's awesome. Please indicate it. Have you or someone you know experienced an issue with the safety of medication? Unfortunately, we know that these happen, and it's quite a vast issue, and that's why we're here. That's why we're here to work on that topic. And is this your first Canadian Medication Safety Network webinar? If you were at our February one, thank you so much for coming back. If you happen to miss our first one, you can find information about the discussion and a full report and some other documents on our ismpcanada.ca resources website, and all of the information is there. And I would encourage you to go and have a look at what was there. Okay, so great. So I see that the survey is being filled. We have quality improvement, patient safety professionals, pharmacy team members, nurses. Happy National Nursing Week to you. Thank you so much for the dedication that you have to medication safety and to patient safety. We're so grateful for the work that you do. People with lived experience on the call, amazing. Oh, look at that. 89% of people have experienced an issue with medication safety, and mostly new people here. So that's amazing. A good chunk of returning visitors, which is incredible. So thank you all. So we'll end the poll there. And there's the results. You can have a quick look. All of this information gets gathered and shared over time. Okay, so let's keep going. So let's get this conversation going. In the chat box, to just tell us, what does safety culture mean to you? What is it? What are the elements of safety culture? Like I said, when we asked at the last webinar, what did people want to talk about? Overwhelmingly, people said we need to talk about building a culture of safety. And that's really the essence of why today's webinar is themed around safety culture, because it is a big issue, and it's safety for patients, but it's also safety for healthcare professionals. And so when we talk about safety, I want to remember to, I would like for you to acknowledge that this is, yes, patient safety, yes, this is healthcare provider safety, because we cannot have one without the other. Just going to look in the chat here. What does safety culture mean to you? We hear about just culture and, psychological safety. Yes, Kelly, thank you. An environment of psychological safety supported with appropriate systems and structures, right? That these are not based on people alone. It has to be system-based. Open dialogue, non-punitive about medication safety events. Safe patient care, yes, safety of healthcare professionals, Sherry, absolutely. It's a team effort for sure. Knowing processes and mechanisms for reporting safety incidents, very, very important. And then giving people the power to be able to report those safely. Thank you. Keep them coming. I'm so interested in all of what you have to say. And so it really is about the organizational culture where errors are about learning. And there's so many different elements and key attributes, and there's a few on the screen there, but there's also things like having strong support from organizational leadership. If those structures aren't put in place, then it can't happen. Acknowledgement of the high risk nature of an organization's activities. Medications are complex and they are risky. And so to have that safety culture acknowledged and to be able to build resourcing into that and those systems and structures in place is key to making it work. There's the determination to consistently have safe operations. It can't just be sort of a project or a one-off. It really has to be embedded into the daily work, the way things are done. And everyone is responsible for the implementation of safety conditions and reporting unsafe conditions. Another and sometimes really challenging characteristic is a blame-free environment for individual reporting of errors or near misses without that fear of reprimand. That's that psychological safety piece that really applies to healthcare providers and the environments that they set up and work under, but also for patients and families too, who are coming with problems or things that they found, issues that they found, and being able to dialogue in a safe way together with their healthcare team. There has to be the encouragement of multidisciplinary collaboration when decisions have to be made to find those different kinds of solutions to safety issues. And that's a key reason for this network. Bringing all of your voices together is truly the way that we will move it forward. And then again, as I said before, that organizational commitment of resources to address safety concerns. So I wanted to share with you this safety culture ladder, and it distinguishes 5 different types of safety cultures. And the higher the safety awareness within an organization, the higher the rung on the safety culture ladder. And so when we look at this, we can see how organizations can sort of tap into where they're at and figure out how to climb that ladder into a more proactive stance on safety culture. So what is required to increase your rung level, I suppose? We need more openness and awareness about risks. That's essential. In a proactive culture, people can report incidents safely and without any fear of repercussions. There should also be the guarantee that the results of these reports and the learnings lead to targeted improvement action, right? Analysis and then improvement action plans that can be implemented throughout the organization in a continuous improvement loop. And we hear a lot about lately psychological safety and what does that look like in the workplace for patients and families. And one of the leading voices is Professor Amy Edmondson. If you receive our safety bulletins, ISMP Canada safety bulletins into your inbox, you will have seen the bulletin from March, I believe, that was written by the ISMP Canada team about psychological safety, referencing a lot of Dr. Edmondson's work. And this video that's linked here, which I think will be linked in the chat as well, is called Building a Psychologically Safe Workplace. And I would encourage you to take a few minutes to watch this TED Talk. So it's 10 or 12 minutes long. There's a piece in the middle that talks about how a team's culture impacts how errors are reported and followed up on. It's really quite an interesting watch while you have a coffee break this afternoon. And so, with all of that very brief overview, I am so pleased to be able to introduce you to Jessica. She is the Senior Assistant Director of Care at Shepherd Lodge Long Term Care in Toronto. She led a team from Shepherd Lodge who participated in the ISMP Canada's Strengthening Medication Safety in Long Term Care initiative that we've had in Ontario with the Ministry of Long-Term Care over the past number of years. And she's going to share some of the work and the learnings from her team over the time that they spent with us as a Trailblazer Home. So over to you, Jessica, and thank you so much for being here with us today.
Excellent. Thank you so much for having me. I would like to really thank ISMP Canada for choosing Shepherd Lodge really to be part of that Trailblazer Homes and for supporting us throughout that journey. I just wanted to share with you, so next slide, Melissa. I just wanted to share with you what really motivated us to get on this journey. As at the time on the pandemic when the Justice Scalia's public inquiry about what happened with She Who Must Not Be Named happened. The report showed that the evidence showed that no one suspected that She Who Must Not Be Named was intentionally harming those under her care, not the residents or their families, not those who worked alongside her, and not those who managed or supervised her. None of the reports from the Ministry of Long-Term Care or even the inspectors who regularly attended the homes were able during that period to figure out what happened or report it. Nothing sounded the alarms for the coroners who conducted the death investigations. And so for us, understanding the incident reporting ratios and what they indicate about the reporting culture was very crucial in our organization. A low ratio suggests that only incidents directly affecting residents are being reported. We looked at our MSSA data. We also looked at the ISMP reports that while there is variation in incident reports, totals differ between different homes. And so incident reports for a home like 0 to 65, they should be around 0 to 65 for a home that's 100 beds per quarter. Our numbers were way lower than that. And so I also wanted to highlight that according to data from ISMP Canada, this could be indicative of a less robust reporting system where only the most severe incidents are brought to their attention. On the other hand, a high ratio suggests reporting culture where all incidents are reported, even near misses, and those with minimal impact. This would indicate an active engagement and vigilance in identifying vulnerabilities and potential risks. At Shepherd Lodge, our objective was to cultivate an actively engaged reporting culture. Our first step was to solicit input. I think next slide. Our first step was to solicit input from the management teams about the culture of reporting. We got information from our nurses, our residents. We really wanted to understand the reasons behind the low numbers of the incident reports that were reported. To assess staff perceptions regarding the reporting of all medication incidences, including near misses, we implemented a staff survey. We utilized resources from the ISMP incident analysis workshops and the SOAP's nursing home survey items and composites. The surveys revealed that positive ratings, while we got really positive ratings from the survey that we implemented, but what really surprised us was that our staff attributed medication incidences to individual shortcomings. And I'm happy to share some of we use basically a lot of information from the Just Culture information that was shared with us from ISMP. And so this perception indirectly discouraged reporting and highlighted the need for staff involvement in incident analysis process. To address this, our objective was to transition to a shared accountability framework for medication incident analysis and reporting. We acknowledged perceptions, and we really stressed the unfairness of solely assigning responsibility to individuals during incident analysis. Plus, we highlighted to staff that placing blame solely on an individual staff or nursing home would not effectively address the systemic issues and prevent similar incidents from occurring. We meticulously examined and streamlined our incident reporting process by shifting from paper-based reporting to direct electronic reporting by the individuals who have identified the incidents. We proactively emphasized the significance of reporting all incidents by prominently displaying relevant information on our communication boards and constant check-ins with our staff. What also helped was our collaboration with an ISMP Just Culture representative. It really played a crucial role in our efforts. We still have a video of Carolyn Hoffman from ISMP Canada that we play for all our new hires, just to highlight the importance of reporting even incidences that might be minute. Through the implementation of these strategies, we witnessed a significant increase in reported medication incidences, particularly near misses, which experienced about a 50% rise. Staff members reported that the shared accountability framework aided in perceiving incidences as systemic issues rather than individual failures. The Just Culture education program played a pivotal role in shifting the perception of assigning blame to individuals. And staff particularly appreciated the explanation around the Swiss cheese model, where it shows it's not really you, the individual, but we also look at our medication systems in order to see where the gaps are. So the survey results at the end, we did do the same survey after, and we still do the survey when we see our near misses going lower, just to get staff, to keep staff motivated, and staff seeing that the survey numbers are going higher. And also we meet with the staff every month to go over the incidences, and we're able to actually trend and look at what can we change in our systems. Through our comprehensive process, we achieved a significant increase in reported incidences, and this rise in reported incidences has allowed us to discern trends in data and identify patterns such as issues with processing of staff medications. Our staff actively participate in various PDSA cycles, recognizing the importance of reporting, learning, and taking appropriate actions to promote a robust reporting system that prioritizes resident safety. The increase in reported incidences demonstrates the success of our strategies and the commitment of our staff to improving medication safety. It is imperative to maintain this continuous cycle of incident reporting and analysis. Without incident reports, identifying root causes becomes considerably challenging, and opportunities for improvement may be missed. We will continue to monitor and analyze incidents, trends, and make data-driven decisions to enhance medication safety in the home. So sustaining a robust reporting system and promoting a culture of continuous improvement are critical to ensuring resident safety and remains a priority here at Shepherd Lodge. Thank you, everyone.
Thank you so much, Jessica, for sharing that important work. That sustaining piece is just so important to continue keeping your residents safe and really acknowledging and honoring the work that your team has done. So, what a great collaboration with all of these different organizations and tools. Just fantastic. Thank you so much for being here today.
Thank you. Thank you.
When you registered for the network, you chose for the webinar, you chose which breakout room, which topic you would be interested in. And in a moment, you are going to magically be transported into that breakout room. And in every breakout room, we do have a facilitator and someone to take notes about the discussion. Please know that this breakout room time is not recorded. Any information that we jot down is de-identified and confidential. It's just collected at an aggregate level. And so we really want to encourage you to be part of the conversation. We keep the breakout room small for that purpose, and we hope that you will find this time to be really beneficial to not only learning, but also sharing your experiences so that others can learn from, we can learn from each other. We also want to ensure that this is a positive time to have that dialogue. And si vous êtes en français, si quelqu'un souhaite participer en français pendant la période de discussion, s'il vous plaît, veuillez l'indiquer dans le chat et Suma vous contactera. So we really do want to engage with you. Have a great discussion. Suma is going to send you out into your breakout rooms. If you do not go automatically to your breakout rooms, please just sit tight and we will get you there as soon as we can. So have a great conversation. We'll see you in about 30 minutes. Okay, terrific. Well, I sure hope that your breakout rooms were full of conversation. I had the opportunity to drop in and listen to some of the conversation, and words like teamwork and prevention and patient safety and healthcare safety. Like, it just sounded very, very rich discussion. So I would love for one gem from a breakout room. Unfortunately, I don't think we're going to have time to hear from all of the breakout rooms, but if one of our facilitators would be kind enough to unmute and jump right in and just give us one little gem of your conversation.
Okay, I'll start. One of our attendees said that what they did to improve the reporting culture was to streamline their reporting software to make the questions more easier and less onerous, and it really helped improve reporting as well. For diversions, they were able to share about diversion prevention in huddles, and they were able to reduce their cases from 50 to 0 in the last month. So excellent work.
Wow, excellent. Thank you, Alice, so much. Mike?
Thanks. We had a very small but very mighty group, and what struck me, and I think we'll all agree with this, is that a patient can tell what the culture of environment is within a few seconds. Mm-hmm. So it does not take long at all for the patient sort of experience to come through for that.
This is very true. Very true. Thank you. Carolyn?
2 words: do something, and a brief explanation. Do something with those incident reports. They need to see the loop closed. When they see the loop closed, it increases the number of incident reports. So what a great group we had on, all committed to safety culture, talking about how do you handle so many incident reports and still close the loop with those reporters. So that's an opportunity for maybe a tool or some work there to help organizations that are in that situation.
Perfectly said. Thank you. Ina?
Thank you. I think our group could rival Mike's. We were small and mighty too, so it was great, great group. We tackled a bigger question towards the end, which was the term safety culture versus culture of safety. We felt that a safety culture was not clear, and therefore, if the question is not clear, the answer can't be clear. So maybe there's some base level work that needs to be done on what does a safety of culture mean, and then organizations can adopt and come through with solutions and answers.
You see, this is the beauty of all of these minds coming together. Julie, go ahead.
You're on
Julie,
mute.
you're muted.
Sorry, we had such great discussion and it's so hard to narrow it to just one thing, but one of our topics was sustainability. And I think one of the things that really came through was the importance of celebrating success and showing people where improvements have happened so that it's not all a negative conversation. And so that's the gem I will share.
Thank you so much. Yeah, you're absolutely right. Sylvia, finish us off, please.
Okay, quickly to say that our group shared products that are out there that could be leveraged, like from HQCA on Just Culture and individual assessments for Just Culture, also from United Arab Emirates, newsletter on high reliability organizations that we might be able to put a spotlight on. And then in terms of knowledge products for future, more to support patients in advancing a culture of safety, and also maybe 5 ideas for each practitioner that they, can quickly do and share that in a knowledge product. And lastly, there was a lot of discussion on celebrating good catches as a way to advance a culture of safety. So thank you.
Absolutely. Thank you. And we have our social media team has recently started hashtag Good News Tuesdays. So watch our social media for that on Tuesdays. Okay, so we are going to go to our last poll of the webinar. What would you like to learn and share about at a future meeting? And so Suma's going to launch that poll. Please choose your top 3. And again, these are derived from your suggestions, from the network suggestions. So please let us know what would be interesting for you, what would keep you coming back. What do you want to know more about? What do you have some great ideas about? We love to learn from you. So by all means, let us know those top 3. Oh, it is neck and neck. The impact of technology and medication safety. Yes, it's definitely something that we continue to learn about and hear about. There's potential for improved safety. There's potential for unintended consequences. So, AI is all wrapped up in there. Okay, thank you. So I'm going to end the poll and show you the results. And again, all of these results will be communicated back to you. So thank you for participating in that. And I'm going to go to, as soon as I close that, my next slide. Again, if you are on LinkedIn, if you would like to join LinkedIn, we have a dedicated group for this network. So by all means, join us in the conversation. If you do not have social media, please do not feel like you need to be a part of this. You will not miss out on any information. Any Canadian Medication Safety Network information goes via email. If you encounter a medication error or a near miss, you can report it. Consumers can report it to mederror.ca, and healthcare providers can report it to our individual practitioner reporting. And thank you, Alice, for posting those links in the chat box as well. There's such incredible learning that comes from all of those report streams. So keep them coming so we can continue to make improvements, system improvements. You will receive a survey about today's webinar. You can either scan that QR code, Alice put the link in the chat, to let us know about your thoughts about today's webinar, any information you want to share with us. Join us on LinkedIn if you would like to. You will receive an invitation to a fall webinar. That'll be the next time we have a webinar event for the network. And you are just so appreciated for being here. Thank you for your attendance. Your voice is crucial to improving medication safety across this country. And already, even with the snippets that I've heard from the different breakout rooms and from the GEMS, we are on this journey together. So we are truly grateful. We look forward to seeing you at the next webinar. And if you would like to get in touch with us, our information is here. There's something specific about the network. please email us at medsafety@ismpcanada.ca and we will get back to you. And with that, I wish you a wonderful rest of your day and week, and hope that the spring weather comes upon you as it is here in the GTA. So thank you. Have a terrific day, and we will see you next time. Take care.